Dear students, today we are going to learn about common bacterial disease. Here are five diseases we are looking for: pneumonia, tuberculosis, gonorrhea, typhoid, cholera. First, first what are bacterial disease? Bacterial diseases are illness caused by pathogenic bacteria invading the body. When a bacteria which is pathogenic, which is causing disease that invade our body, these harmful microorganisms multiply rapidly in our body and then produce toxins, and it cause direct tissue damage. Either the toxins causes damage or the bacteria itself causes damage to our body, and it lead to a wide range of infections. It leads to symptoms, a disease like that. The transmission occurs through the multiple routes like airborne droplets or through contaminated food and water or through sexual contact and maybe poor hygiene practices of humans. So most bacterial infections are treatable with the antibiotics, and also several can be prevented through the vaccination. However, antibiotic resistance is growing concern for the proper use is essential. So poor hygiene and inadequate sanitation remain major factors that promote the spread of bacterial diseases worldwide. Next, classification based on transmission. Uh, Based on the transmission, we can classify into three types. First one is airborne diseases. That means these diseases are transmitted through the air. For example, like pneumonia, tuberculosis, like that. It is spread through the respiratory droplets from coughing or sneezing or close contact with infected individuals. Another one is water or foodborne diseases. For example, typhoid or cholera. In this type of disease is transmitted through the contaminated drinking water or improperly prepared food or spoiled food, poor sanitation practices like that. Uh, Poor sanitation practices. Due to poor sanitation practices, the causative agents will be enter into our gastrointestinal route. Another one is sexually transmitted disease. So, for example, is gonorrhea. It passes through the sexual contact and from the mother to or from mother to newborn during childbirth. First, we are looking for pneumonia. Pneumonia is an infection that inflames the lungs. That means the infection is caused to lungs. It causes the air sacs to fill with the fluids or pus. Mm. This leads to the difficulty in breathing. That means exchange of oxygen, carbon dioxide in the alveoli. To reduce the oxygen absorption in blood. The major causative bacteria is Streptococcus pneumoniae. It is the most common cause of bacterial pneumonia. Even though there is another microorganisms like the Haemophilus influenza, it is particularly caused in children and immunocompromised individuals. And another one is Staphylococcus aureus. It often following viral respiratory infections. The pneumonia transmission is by droplets from the coughs or sneezes or by close contact. The symptoms of pneumonia are fever, and main one is productive cough because it causes lungs and also chest pain. So there is also difficulty in breathing and maybe chills and also fatigue. These are the symptoms for pneumonia. The diagnosis of pneumonia is by chest X-rays. And mainly and common diagnosis method is chest X-ray. And also we can do sputum culture for further investigation and also blood test. The treatments are antibiotics and oxygen therapy in severe cases like that, breathing difficulty in the patients who have the breathing difficulty, and also with the rest and fluid intake. The prevention for pneumonia by pneumococcal influenza vaccines and also hand hygiene and avoid smoking. Another disease is tuberculosis. We shortly call it as a TB. It is a chronic infectious disease, it primarily affecting the lungs. And it is the causative organism is Mycobacterium tuberculosis, a slow growing bacterium that is spread through airborne droplets. The transmission is by airborne disease. It is an airborne disease. The transmission is by airborne droplets from coughing or sneezing. The symptoms of tuberculosis is persistent cough greater than 2 weeks or 3 weeks. Uh, the blood in sputum also seen in severe cases. There should be a fever and night sweats. Weight loss is a characteristic symptom of tuberculosis and should be the will be a patient has fatigue. Diagnosis of tuberculosis can be done by Mandos test, chest X-ray, because it affects the lungs, sputum smear, and genespert. The treatment can be done by anti-TB drugs for 6 months. It is a noted point for 6 months, or if needed, it will be long. Prevention is can be done by BCG vaccination starting from birth, and early diagnosis is essential for the early recovery. And isolation is a must. Isolation of patient is a necessary action, and good ventilation is needed for the affected person. Next disease is gonorrhea. Gonorrhea is a sexually transmitted bacterial infection. It is primarily affect the reproductive organs like the urethra, cervix, and fallopian tubes. If it left untreated, it can lead to severe complications like pelvic inflammatory disease and also infertility. The causative organism is Neisseria gonorrhoeae. Neisseria gonorrhoeae. It is a gram-negative Diplococcus bacterium that thrives in a warm, moist areas of the reproductive tract. The transmission of gonorrhea can happen by sexual contact and also can be also during childbirth. From if mother is infected, it will be transmitted to newborn during childbirth. The symptoms seen in males are the painful urination and pus discharge through rectum. And the symptoms in females is vaginal discharge and pelvic pain is also seen and burning sensation while urination. Prevention can be done by safe sexual practices and also condom use while sexual contact. The regular screening is essential for the diagnosis or early detection of the disease, and early treatment after diagnosing the disease is must. Diagnosis can be done by urine test and mainly swab from the affected site like cervix, urethra, or rectum or throat. The treatment can be done by, of course, antibiotic by uh, prescribed by a specialized doctor. Next disease is typhoid fever. It is see the picture. It affects the gastrointestinal tract. It is an intestinal bacterial infection affecting the digestive system. It is caused by here is a pathogen is Salmonella typhi. Listen, the name Salmonella typhi is causing typhoid fever. It is a gram-negative bacterium that invades the intestinal wall. It invades intestinal wall of gastrointestinal tract and it is spread to the bloodstream. It spreads to the bloodstream from the intestine and leading to systemic illness. The transmission of typhoid is we can assume that this mostly through contaminated food and also from water. The poor sanitation and hygiene is causing the transmission of disease. The symptoms of typhoid are high fever and also headache is seen. Must be a weakness in patient. The abdominal pain must be seen since it is affect the gastrointestinal tract. Constipation or diarrhea is seen. More commonly seen diarrhea. And also there should be loss of appetite because it affects the gastrointestinal tract. In severe cases, blood is seen in stools. Diagnosis of typhoid can be done by a blood culture. The blood test of the typhoid is called by Weidel test. A stool culture also can be done to find out the bacteria. The treatment can be done by antibiotics, and oral dehydration solution is essential if there is severe diarrhea. And also, adequate nutrition is essential for the recovery of patient. The prevention can be done by safe drinking water and hand washing after toilet and before eating food and drink. And proper food hygiene is needed and avoid spoilage food is eaten. Typhoid vaccination can also prevent the disease. Next disease is cholera. Cholera is an acute diarrheal disease that causes severe dehydration. It also, by the name, we can know that it also affects the gastrointestinal tract and causes severe diarrhea. So it may be life-threatening if it is untreated. The causative pathogen is Bacterium Vibrio cholerae. Cholerae is the causative organism of cholera. Vibrio cholerae. It is typically transmitted through the contaminated water and food. So, rapid fluid loss through the profuse watery diarrhea can lead to shock and there also lead to death within hours without a prompt dehydration or medical care. The is transmission of disease happening by from contaminated water and food and also caused by poor sanitation and hygiene. The symptoms are profuse watery diarrhea. Listen this word, profuse watery diarrhea. It is a characteristic symptom of cholera. Watery diarrhea means the stools look like a rice water. That is called watery diarrhea. Profuse watery diarrhea, continuous diarrhea. The vomiting may be seen. And muscle cramps also seen because should be dehydration. A severe dehydration can be caused by profuse watery diarrhea. There will be shock if it is untreated, then death may happen. The rapid onset dehydration can be life-threatening without immediate oral dehydration therapy. So, diagnosis of cholera can be done by stool culture to confirm infection. And rapid diagnosis tests enable quick detection in outbreak settings. The treatment is mainly oral rehydration solution (ORS) to prevent dehydration. It is a cornerstone of care. Oral rehydration solution is must. And also we can use intravenous fluid in case of severe dehydration. And antibiotics in selected cases can be taken to attack the pathogen. Zinc supplementation is recommended for children because diarrhea may lead to zinc deficiency. The prevention can be done by ensure safe drinking water and proper sanitation and hygiene practices, regular hand washing with the soap, and oral cholera vaccine available for high risk population. And thank you for listening me. I am taking a five bacterial diseases. Listen to the videos and ask any questions.